Hello and good evening. Today's discussion is on hypersensitivity reactions. The immune system in our body is designed to protect us, but sometimes it overreacts and could become harmful instead of protective. This condition is termed as hypersensitivity reaction. So today I'll discuss on this topic, but in very brief. I'll be highlighting only the important points, and I'll discuss the four main types of hypersensitivity reactions with their mechanism, example and clinical significance, but in very short form. To define, hypersensitivity reactions are exaggerated or inappropriate immune responses that cause tissue damage. Classification. Gell and Coombs classified this condition in four types. Type 1, immediate hypersensitivity reaction. Type 2, antibody-mediated cytotoxic hypersensitivity reaction. Type 3, immune complex-mediated hypersensitivity reaction. And type 4, delayed cell-mediated hypersensitivity reaction. So in brief, I'll discuss all these four types. Type 1 hypersensitivity reaction, it is IgE mediated type and the onset is within minutes. The main mechanism in this is, it is on exposure to the allergen, there is IgE mediated reaction occurring with the mast cell degranulation. That is the main key event, and then there is release of histamine and other mediators. An example of this type of reaction is anaphylaxis reaction number 1, then allergic rhinitis, that is hay fever, asthma, urticaria, angioedema. So all these are falling under type 1 hypersensitivity reaction. The mechanism of type 1 hypersensitivity reaction in more detail. So in first exposure, the person gets sensitized. Soon after the person is exposed to the allergen, this allergen is taken up by antigen presenting cells and is presented to T helper cells, especially the Th2 cells. Then Th2 cells release cytokines like interleukin 4, interleukin 5, interleukin 13. And these cytokines stimulate the B cells to produce immunoglobulin E. This immunoglobulin E antibody binds to mast cells and basophil via the Fc receptors, and the person is sensitized. And during this phase, patient remains asymptomatic. There are no symptoms. Then if the person gets re-exposed to the same allergen, then the allergic reaction starts. So here during this phase, soon after there is a exposure to same allergen or antigen, this antigen binds to immunoglobulin E antibody, which is already attached to the mast cell during the sensitization, and there is no antigen presenting phase. So it leads to cross-linking of immunoglobulin E and triggers mast cell degranulation, and there is release of preformed mediators like histamine, tryptase, leukotrienes, prostaglandins and heparin. So in this diagram you can see in the initial or the first exposure to antigen or allergen, patient gets sensitized but they remain asymptomatic. So that is seen in this part of the figure. Here the antigen is taken up by antigen presenting cells and it is presented to T helper cells, especially the Th2, where the cytokines are released and then which stimulates the B cell to produce immunoglobulin E. This immunoglobulin E goes and binds to the Fc receptor of the mast cell and gets sensitized. And the same person, if gets exposed to the same allergen second time, So on re-exposure, there is no antigen presenting cell and phase, so it goes and directly attaches to the IgE antibody, which is already attached to the mast cell, and then there is degranulation of the mast cell, so this occurs very rapidly, and there is release of histamine, leukotriene, prostaglandins, leading to the symptoms. Patient becomes symptomatic. There is vasodilatation, wheal and flare, edema, redness, itching can occur, and this re-exposure phase is presented in two phases. One is early phase, another is late phase. So on re-exposure to the during the allergic reaction, they show immediate reaction, immediate phase, that is immediate reaction within minutes. So in this, during this phase, predominant cell is the mast cell, which undergoes degranulation, and the main mediator in this phase is histamine. But there is also release of tryptase, chymase, heparin, leukotrienes, and then they lead to the symptoms like urticaria, wheezing or bronchospasm, hypotension or shock. And then 4 to 8 hours later, there is a late phase. During this time, predominant cell is eosinophil, lymphocyte, neutrophil, H2 helper cells, basophil. So there is infiltration of these cells, and the other mediators are cytokines, leukotrienes and prostaglandins during this phase, and there is recurrence of the same symptoms again, and there is persistence of the symptoms. So during early phase, antihistamine is the treatment, and during late phase, since there is inflammation, you should give, there is role of steroid and anti-leukotrienes. Now, type 2 hypersensitivity reaction. This is antibody mediated cytotoxic hypersensitivity reaction, which occurs in hours to days, and the main mechanism in this is antibodies, that is IgG, IgM, that binds to the antigen on the cell surface, antigen which is present in the cell surface, and then activates the complement pathway and leads to the cell destruction or lysis. Beside this, there are other three mechanisms which I will be discussing in the coming slide. And the examples of type 2 hypersensitivity reactions are autoimmune hemolytic anemia, mismatched blood transfusion, hemolytic disease of the newborn, and rheumatic fever. In rheumatic fever, it is not exactly occurring in this phase, but partly it is following this mechanism. In rheumatic fever, there is molecular mimicry. This means there is some antigenic similarity of the body tissues with the streptococcal pathogen. So especially the streptococcal M protein, against these antibodies are formed, and those antibodies comes and attacks the tissues where they have the antigen similarity, like in the heart, joints and different parts of the body, different tissues. So this mechanism is known as molecular mimicry, which is mainly followed in case of rheumatic fever. So different mechanisms. After the body makes the antibody, that is IgG, IgM, this binds directly to the cells and forms the antigen antibody complexes on the cell surface, where number 1, complement is activated, known as complement mediated cytotoxicity, and this is the most common mechanism occurring in this type of reaction. And then cell gets lysed because of the activation of the complement system. Another mechanism is antibody dependent cellular cytotoxicity. Here the antibody which coats the cell on the surface is attacked, or where NK cell, that is the natural killer cell, binds to the Fc portion of this antibody via the CD16 and leads to cell lysis. There is no complement involvement in this. Third is by opsonization. The antibody coated cell is recognized by the macrophages, and then the cell is phagocytosed. This is the way they kill the cell. And another is by receptor effect. The antibody bind with the receptor and then alter the function of the tissues. So receptor effect can be either block or overstimulation. So if there is a receptor block which is occurring in myasthenia gravis, so the function is altered. And in receptor stimulation, example is Graves' disease, here also the function is altered. So this is the mechanism which is occurring in type 2 hypersensitivity reaction. So this is just the example of the cytotoxic hypersensitivity reaction, where the antibody which is formed is bound with the antigen which is present on the cell surface, and then there is activation of the complement leading to lysis. This is the main mechanism which is seen in type 2 hypersensitivity reaction. Now type 3 hypersensitivity reaction. This is immune complex mediated reaction. The onset is 1 to 3 weeks after the initial infection. Mechanism: circulating antigen antibody complexes, it gets deposited in the tissue, which leads to complement activation, and then there is inflammatory reaction. The examples of this type of hypersensitivity reactions are post-streptococcal glomerulonephritis, systemic lupus erythematosus and other vasculitis, and serum sickness. So in the diagram you can see these are the antigen antibody complexes which are circulating in the blood, and then this goes and gets deposited in the tissues, leading to damage with the activation of the complement. Activation of the complement system is the main mechanism in type 3 hypersensitivity reactions. This was also seen in type 2 hypersensitivity reaction, but there was some other mechanisms also. Type 4 hypersensitivity reaction. This is delayed cell-mediated hypersensitivity reaction. The onset is in days 2 weeks, and the mechanism is antigen binds to the sensitized T cell, and there is a release of cytokines. Cytokines are interferon gamma, tumor necrosis factor alpha and beta, interleukin 2, interleukin 17, interleukin 22. The examples is the tuberculin skin test, that is the MON2 test which you do to diagnose tuberculosis in children. Granulomatous inflammations, the good example is tuberculosis, and contact dermatitis. So all these are falling under type 4 hypersensitivity reaction. So if you see the diagram, this is the antigen presenting cell presenting to T lymphocytes, and then T lymphocytes is sensitized. Sensitized T lymphocytes is releasing the cytokines, and this leads to damage to the cells. In short, in brief, these are the 4 types of hypersensitivity reactions you can see. So this is IgE mediated. So on second exposure, the antigen is directly going and binding to the IgE antibody, which is already attached or bound to attached to the mast cell, and there is degranulation of the mast cell leading to the features. Good example is anaphylaxis, and can occur in minute to hours. Type 2 antigen antibody cytotoxic type of reaction this is. So this is a antigen and antibody reaction on the cell surface. In hours to days it can occur, and all the hemolytic anemias is the example. Type 3, the antigen antibody complex is here, so this one is circulating in the blood, and it goes and gets deposited to the tissues, different tissues, and there is activation of the complement leading to damage to the cells. So duration 1 to 3 weeks is the duration. And then type 4 is the T cell mediated. Sensitized T cell is releasing the cytokines. So duration is days to weeks. leading to damage to the tissue. In summary, for easy memory trick, you can remember acid. A standing for anaphylactic type 1 hypersensitivity reaction. C standing for cytotoxic type 2 hypersensitivity reaction. I standing for immune complex hypersensitivity reaction, that is the type 3 type. And then D, delayed cell mediated hypersensitivity reaction, that is type 4. Okay, thank you. This was a short class. In brief, I tried explaining hypersensitivity reactions. Sometimes this is very important in a clinical setup. Thank you.